Rural hospitals are a dying breed, but we need these small rural hospitals. We can't afford to let them shut down, not in this state.
Greene County is the smallest county in population in the state of Alabama. It's one of the poorest. It's one of the Black Belt counties of Alabama. Black Belt refers to the soil, to the people, to the cultural and economic history of the area. The Greene County Hospital has a deficit because we do not turn people away. And we have been providing approximately $100,000 a month in uncompensated care. Together with my wife, we are the co-publishers of the weekly newspaper that serves Greene County, and we have been doing that since 1985. In this week's newspaper, the first story is about a play that a local person wrote, and the play is going to be performed as a benefit for the Greene County health system. We have another story about the sheriff distributing money from electronic bingo in Greene County, and that the hospital is a recipient of some of those monies.
It feels like a ticking clock that we are not able to say definitely this hospital is going to stay open or how long it's going to stay open. It's every rural hospital in the state of Alabama, and especially in the Black Belt of Alabama. The hospitals all over the state are struggling. I work with the Greene County Industrial Development Authority. The goal of my job as economic developer is to attract business and industry to the community and to retain the existing business and industry. What business wants to move to a state that's closing hospitals? What business wants to move to a town that's closing hospitals? Dr. Pugh is the hospital administrator for Greene County Health System. It's because of her passion that she's been able to stabilize as much as she can without the addition of Medicaid.
Healthcare is one of the cornerstones for economic growth, and without a hospital and healthcare, you really can't grow. The hospital employs about 150 people, which is one of the largest employers in Greene County, so it's vital that we keep this facility.
I don't know that there would be any options if the hospital were to close. It's a matter of life and death, often. A hospital has saved so many lives in Greene County.
My name is Pamela Gainey. This is my husband.
And I'm Russell Gainey. I'm in love with her.
About 2.5 years ago, we moved here from Louisiana to Alabama to come and take care of his mother. It's like starting all over. We're living with my mother-in-law, taking care of both our elderly parents. We have access to the Greene County Hospital. It's about 15 minutes away.
And we depend on that service right away. It's life and death.
I was diagnosed with breast cancer 3 years ago, which is very, very hard. What I need with my cancer is to be able to keep up on it so it doesn't come back on me. If the Greene County Health System would close, it would be devastating.
Yeah. People would be in a bond. Tuscaloosa's a long ways from here when you're bleeding or broken. It's bad, you know? Somebody in life that situation, it wouldn't be good at all. And my wife, she looks good, but I know she's not healthy.
It's like I have no control. I've always taken care of myself. I've always did the mammograms, but now that this particular symptoms are coming up, it just makes me feel like I'm on my own. We don't want a handout from Medicaid. I mean, it's hard for people to be in this situation. Other people look at it like you're not doing something. We are blue-collar workers. We're the ones that are at the bottom that hold that pyramid up. And people forget about us. We're the ones that put into all the health care. We pay our taxes. It's alarming to know that they may shut down these small places.
Yeah.
And for healthcare, it's not going to be good at all for these rural communities.
Greene County is no different from any other county in Alabama or the United States. Everyone needs access to health care, and you want the best health care you can get. We're struggling just like all other rural hospitals across the country.
My name is Lee Carter. I live right here in the big city of Otagoville, Alabama. This is where I grew up. This is my hometown. I'm the only doctor here. If I go to Walmart, it's a 2-hour trip because I can't walk through the door, without getting stopped. If I'm at the cafe, I treat 2 or 3 patients down the street. If I'm at church, and I've grown used to that. That's just how life is in a small town. You see somebody, they're gonna ask you a question. It doesn't matter. It's a little bit of everything. Healthcare everywhere is hard to find, and so I decided I could set up shop and do it just about as good as I could anywhere else. Hey!
Hey, Dr. Carter.
How are you?
I'm fine.
Doing well. Santana's been one of my first patients when I got here in 2009. A sweet lady, and she's had her ups and downs through the years and had to work hard to get to where she is. And someone who's I'm very proud of. I've taken care of her kids, I've taken care of her, and she is somebody who has done wonderful in life, but had a struggle getting there.
I am an infant toddler teacher for Head Start, full-time. I make $16,000 a year, and I live in Prattville. I was diagnosed this January with type 2 diabetes. The first thing was going through my head is, oh my God, I'm gonna die. Without having medical insurance and having diabetes, it can get expensive. In Alabama, making $16,000 a year is basically minimum wage, but it's too much to qualify for Medicaid and not enough to afford insurance. For the test scripts, I spend like $150 a month because I have to prick myself at least 3 times a day. Dr. Carter is the kind of doctor that you don't have to have insurance. He will accept you. Just come in, sign in, and he will see you.
Folks that can't pay, that happens quite a bit. We try to work with them the best that we can here, whether it's let them make a payment plan that they're good with. Sometimes, we'll take whatever they can bring in, whether it's a meal, they want to fix a bowl of soup or something, and they'll bring it in. I've gotten pies, I've gotten cakes, I've gotten fresh eggs. Deer meat, the guy brought me a whole case of deer meat one time because he couldn't pay his bill off, so he just brought me a case of deer meat. So that's the kind of conversations that you have. How much will you charge me because I can't afford this? There's no way I can feed my kids and pay the light bill and pay $400 a month for insurance. I've borrowed money to make payroll before. The business model that entails is not good. Everybody works hard. You work in a 40-hour-a-week job. I don't care where you are, you're working hard. And you work that hard, you're making $18,000 a year, and then you're $400 a month short for insurance. I mean, that's frustrating and saddening and distasteful all at the same time, because that kind of gap makes it almost impossible to come see me for preventative care. And that's what really matters, is keeping you well instead of having you sick and missing work. Preventive care is the epitome of what I'm supposed to be doing. It's what I want to do. Keeping you healthy and keeping you out of my office is just as important as you coming in when you are sick. Medicaid expansion would be a good thing for everybody. As far as for here, for Otagoville, for small towns across Alabama, it would change a lot of things. It would allow more people to go to the doctor. It would allow more people to get the medicines that they need. It would allow people in places like mine to be able to flourish and take care of all those people.
Beyond our struggling hospitals and doctors, everyday citizens are struggling. They're doing the best they can, but they're in constant fear of the unexpected because so many of them don't have adequate health care.
Dude, you know I love you, right? All right, girls, good job today. Go home and take a shower, please. My name is Adria Jones. I am a small business owner. I go to school full-time, and I'm a single parent of 2 small children. I grew up in a dance studio. My mom actually had a dance studio. I graduated high school and moved away to Savannah. My mom always, throughout the years, tried to get me to move back. And when both of my parents died in 2012, I just felt like my children needed to be around family. And moving back, I was just basically faced with, you gotta feed your family, what are you gonna do? Okay, well, you're gonna open up a dance studio.
When Adria moved back home and reopened the studio, we were so excited. It's continuing a legacy for us. I'm Candy Garmany. I was actually a student of her mother back in the 80s and 90s. My daughter loves dance. It not only teaches them, life skills, discipline, and self-confidence and those things, but it teaches them to give back to their community. And Adria is very focused on teaching them more than just dance.
You've got to really bring the crowd into that so they know what you're doing. Put your toes straight in your legs and count your music. It's so much better when you count your music and you're on your child. Okay? So let's go. Moving here is the first time I've been without medical insurance. All my life, I've always had medical insurance. I have a family to support. I have my studio bills and then I have my house bills. Medical insurance for a small business owner is very hard. I make too much for Medicaid and I don't make enough to get any kind of help, through Obamacare or whatnot. I haven't had a checkup in probably 5 years and I've never had a mammogram because, not having insurance, I'm not able to afford it. My grandmother, she had breast cancer. That's very alarming for me because, that there's a chance that I may have that, but for me not to be able to know that, that's very scary. If I were to get sick where it would put me down, I couldn't go to work, there's no one to come in and teach my classes for me. I just have to pray. Please don't let me be sick.
We have a fair number of patients who are uninsured. They tend to wait on getting that mammogram. They tend to wait on getting their vaccines. They tend to wait on other things that cost money because they're trying to save to take care of their family.
I know that there are other people that are affected, in the same. And, we work hard. It's not like I'm out here, trying to not work and to not pay my dues and to do what needs to be done. I just would, a little bit of help, just raise the bar or whatever so that way that I can afford to be able to give myself health care.
In our town, we have lots of farmers. We have mechanics and electricians and plumbers and people that provide services that everyone needs. A lot of them are in the same situation Adria is. They just can't afford that high cost of insurance, and so they're all live with that worry in their mind every day. We have so many people who don't seek treatment at their doctor's office until it's almost too late. And then the costs are so much more. People worry so much more about the financial impact of it than they do on their health.
If people don't access the preventative care at the hospital, there's a huge consequence to that in the long term. They may have to pay $300 to get a mammogram now, but if they skip that and that requires a hospitalization, a surgery, you're talking tens of thousands of dollars. So $500 of prevention ends up being $50,000 or $100,000 of treatment.
I've known Adria my whole life. She is not a person who wants a handout. She has worked her whole entire life and, going to school and working now. It's a temporary help that she needs, and that's the situation that so many people are in. Folks that just need that help to get over the hump.
I am putting in my part. I am trying to do what I need to do to better myself and my family. I just need a little help. I would love for my children to grow up in a world where people have a genuine concern for each other and care for each other's well-being and happiness, and that's what I want for my kids.
If you invest in healthcare, you can grow your economy because you're creating jobs. People are going to work. They're spending more money in the stores and investing in real estate, investing in the schools. So it helps the entire community to have a good healthcare system. Whether it's in rural Alabama or in Birmingham or Montgomery, it's important for all of us.
you.